Guatemala is expected to bring 5 victims affected by the U.S. medical experiments to a hospital in Guatemala City. BTV News reporter Yasmin Hazal investigates.
The syphilis victims were expected to be brought to medical facilities for medical tests and to determine their state of health. Doctors also plan to investigate any possible consequences of the medical experiments. The victims were part of a shocking medical experiment carried out in Guatemala in the 1940s as part of a study on syphilis.
In the process, there was a group that followed another group who were injected with syphilis, and another group who were injected with syphilis and other venereal diseases who they lost track of. And this group led to the outbreak in the 1950s and 60s.
The doctor who led the research on syphilis experiments has recently criticized the Guatemalan government for not better representing the victims. Dr. Delgado says the victims' rights had to be protected and they should receive compensation. The doctor also says in certain cases, children and grandchildren of victims were also affected by the studies.
I regret the official position of the Guatemalan state, which should be required to represent the rights of citizens who were affected and who should receive compensation for the damage caused not only to the victims, but also their families.
The researchers apparently were trying to see if penicillin could prevent infections in the 1,300 people exposed to syphilis, gonorrhea, and chancroid. Those infected included soldiers, prostitutes, prisoners, and mental patients with syphilis. The commission revealed on Monday that only about 700 of those infected received any sort of treatment. U.S. President Barack Obama called Guatemala's president to apologize and ordered his bioethics commissions to review the issue. Yasmin Hazal, BTV News at 7.